Prisbella, third year BSc Nursing, is going to present the case on lower respiratory tract infection. Yes, let's proceed.
Good morning all, good morning ma'am. So myself Prisbella from BSc Nursing third year. So here I am going to present my case about lower respiratory tract infection. So as a part of childhood nursing, I was posted in Masoni Childhood Hospital, and here I saw a patient named Mr. Neelam. He's a 1-year-old male, and he got admitted in Masoni Children's Hospital at 22nd, 3rd, 26 with the chief complaints of cough, fever for last 3 days, and fast breathing. So after thorough investigation like blood test, chest x-ray, and cross-matching, doctor diagnosed as a case of lower respiratory tract infection. And now he is undertaking medications like paracetamol and salbutamol nebulization. So his family history is, in his family he is living in nuclear family, and there is no hereditary diseases such as hypertension, diabetic mellitus or asthma in his family, and no communicable diseases like tuberculosis and AIDS. Socioeconomic background is Neelam is living in urban area. The type of house is Pakka house, and his family has all the basic facilities like water supply, good electrical supply, and good closed drainage system. His past medical history, he has no any history of past medical history. His immunization history is at birth he got BCG, OPV, and hepatitis B vaccination. At 5 weeks he got pentavalent, at 10 weeks pentavalent 2, 14 weeks OPV 3, and 9 months MRI. In his personal history, he maintains proper oral care and baths daily. In his physical examination, he got temperature of 102.5 degrees Celsius, and he has tachypnea with 40 beats per minute. While taking his condition, lower respiratory tract infection is an infection which affects the lungs, mainly affecting the parts of lungs like bronchioles and alveoli. Here we can see in normal bronchiolitis, we can see clear airway, but in bronchiolitis we can see excess mucus production here in the airway.
So it blocks the airway, so the patient cannot able to breathe easily. That will be a breathing difficulty. The major complaint is the breathing difficulty because of the constriction of the airway.
Next we can see about signs and symptoms. Mainly signs and symptoms are fever, cough, irritability, lethargy, tachypnea, dyspnea, wheezing, and nasal flare. Next, the cause of lower respiratory tract infection is mainly 3: viral cause, bacterial cause, and fungal cause. Viral cause includes influenza virus, adenovirus, and coronavirus. Bacterial viruses like Streptococcus pneumoniae, Haemophilus influenza, and Staphylococcus aureus. And fungal causes like Candidias and Aspergillus cause lower respiratory tract infection. And non-infectious causes like aspiration, like if you aspirate food or milk particles or vomit, allergic reactions, and air pollution and chemical inhalation. Next we can see about nursing diagnosis. Ineffective airway clearance related to excess mucus secretion as evidenced by patients having cough. Impaired gas exchange related to infection in the alveoli evidenced by tachypnea. Hypothermia related to infection evidenced by temperature. Activity intolerance related to weakness evidenced by fatigue. And anxiety related to hospitalization. So in conclusion, lower respiratory tract infection is mainly caused by infection in the airway, which affects bronchioles and alveoli, and causes breathing difficulty. Thank you.
So what are the main signs and symptoms the patient is having when the patient is admitted in the hospital?
Fever about 102 degrees Celsius, and cough, and tachypnea about 40 degrees.
Okay. So what are the main nurse's responsibility for taking care of the lower respiratory tract infection patients?
By maintaining clear airways, by giving nebulization, and giving medication to reduce the fever medication.
What are the health education you can give to the parents to take care of the baby?
To reduce the infection as he is a child, there is a higher chance of getting the infection. So to reduce the infection, we can give health education, and to reduce the fever, we can give take this punch.
Then advise the patient to have some healthy foods and always make the child to be in a hydrated one. Yes, so they need to avoid the dehydration because the patient is having a temperature. So through clear airway, we can able to reduce the risk of the patient, and also through proper hand hygiene, we can reduce the spread of infection from one person to the another person. Yes.